Hello, I'm Dr. Palma, a vascular surgeon from SUNY Upstate Medical University in Syracuse, New York. I'm here today to review an aortic case, which is well suited for repair with the ALTO endologic device. This is a 72-year-old female who has incidentally found to have an abdominal aortic aneurysm that had slowly increased in size. The maximal diameter was 5.1 centimeters, and I noted that she had small access vessels and a small distal aorta with calcification. Given her medical history, which includes aortic valve replacement, hyperlipidemia, and a smoking history, an endovascular approach was considered. I will mention a couple of additional anatomic considerations. There is a patent inferior mesenteric artery and 3 sets of notable lumbar vessels. There was a paucity of thrombus in the aortic sac, allowing for a large flow lumen. Here are representative CTA images which demonstrate her access vessels, small distal aorta, and some calcium at the aortic neck seal zone. You can see how the device is sized to the right with a 23 millimeter ALTO main body and bilateral limbs measuring 14 millimeters each. These images depict the patent inferior mesenteric artery and lumbar arteries, which would serve as a source of a type 2 endoleak. On the right, one sees the flow lumen measuring 4.5 centimeters, which could make gate cannulation difficult. After an informed discussion with the patient who was concerned about a type 2 endoleak, we decided to use the shaped polymer plugs, which have been shown to decrease the risk of type 2 endoleaks. This slide demonstrates the delivery cartridges on the left that are then loaded into a 6 French flexor check flow sheath that is advanced through the bilateral common femoral artery sheaths, in this case on the right a 16 French and on the left a 12 French. And as you can see to the right, this approach provides a clockwise delivery approach with wires curled in the sac on each side. And then to the right, these plugs then will fill the sac, ultimately obstructing the branch vessels. Once the main body is delivered through the 16 French sheath on the right, just below the lowest renal artery, the mid-crown is deployed for parallax adjustment, followed by the proximal fixation. At 14 minutes, the integrating molding balloon is used once the polymer has been administered. Here are the images demonstrating the positioning of the plugs. This video mid-screen shows a saccogram with plugs and some lumbar arteries filling. However, on the next video, after more plugs are placed and after some time has elapsed, the lumbar arteries do not fill. Finally, here is the original aortogram run, which shows you filling also of the branch vessels that we've discussed, and the final completion angiogram with successful obliteration of the aneurysm sac and no evidence of type 2 endoleak inside the sac. Thank you very much.